Patients most at risk for bladder cancer are patients who have smoked themselves or who have exposure to secondhand smoke. It's definitely the leading cause of bladder cancer in males and females, although we do see bladder cancer in patients who have never picked up a cigarette and have never had exposure to secondhand smoke. So I would say the most common symptom of bladder cancer is urinating blood. Most people that have bladder cancer will have some episodes of bleeding in the urine. However, there are certainly patients who present in different ways. Men can develop getting up at night to urinate more frequently. Men can develop frequency, urgency, or burning, and women as well. If it's advanced to bladder cancer, they may have symptoms of the disease that has spread outside of the bladder. So they may get pain in the back, pain in the bones. But definitely the most common presenting symptom for both men and women is blood in the urine. Treating bladder cancer usually is done first by diagnosing the bladder cancer. That's usually done with an outpatient procedure called a cystoscopy, where one takes a telescope, looks in the bladder, sees the polyp or the tumor, and removes it with some electric cautery, sends it to the pathologist who analyzes the tissue, and that's how we come upon the diagnosis of bladder cancer. I think that when patients are faced with a diagnosis of bladder cancer, that is an extremely scary predicament that they are in. And to be told, oh, your next appointment may be in 2 weeks or 3 weeks or longer. The 3-Day Promise program here at Tanner is unique to this facility. It allows diagnosis to treatment options within a 3-day period. When they're able to have all their answers within 3 days, the benefits are so amazing for the patient. Bladder cancer can present in so many different ways. Men can think they have prostate issues with getting up too much at night, having urgency and frequency. Women can have urgency and frequency. All of those could be signs of early bladder cancer that, if found early, can definitely be treatable. So don't ignore your symptoms. Come and see the physician.